In one village contact project, you have two initiatives. The Let the Little Children Come to Me Orphan Center Support Initiative, and also the Huye Health Center Capacity Building Initiative. In Rwanda VCP, we take initiatives as activity that VCP is involved in, but not the activity that VCP is initiating. So the RCCM Support Initiative, it was a center started by 12 mothers, parents from the Huye. So they started to help the local people, and by helping them, they noticed that there are a lot of children that are left behind when their mother are dying from HIV, and also there are other children that were left orphans because of the genocide. So they started thinking of an initiative where they can provide real support to those children. So they contacted VCP in 2003 to see if we can provide devices, but at the time VCP was still building up and we didn't have capacity to support them. In 2006 we came up with a real proposal, worked between the coordinators of the center and Rwanda VCP, and we submitted the proposal to different funders. The first initial support we got was from the Bristol Volunteers for Development Abroad. Then after we started linking the center with the Tusken Haven Kindergarten in Denmark, now we are getting the support from Firelight Foundation. The activities done there, they are different, but I can divide them in some sentences. So we are supporting the schooling of the children, we provide the health education, we provide income generation, there is handcraft program, saving program. And for the families, that the guardians of the children, we provide some income generation. Now we have the vegetable cultivation, and we provide also food for the children. We are thinking of starting the psychosocial support, work with the psychiatrist so that we can help those children, and also to monitor the health care of those children. Most of them are affected by HIV. The initial survey we did, we tested 28 of them because there are 170. Then 100% from the 28 were HIV positive. And 18 are under antiretrovirals, but also they don't have enough food. So sometimes it is not easy also because we have to link the healthcare and also the other social part of the patient. So in the future, we want to focus on helping those children taking the antiretrovirals and also make sure that all the children are tested and they are registered at the district, because most of them, they are living in the families, but also they are not recognized officially. They don't have a mother, they don't have a guardian, they're just living in the family. We want to respect their child rights and also to get them registered. Maybe they can be adopted or they can live in the family but be recognized by the government that kid is living somewhere. One time I was giving a session with other volunteers from VCP in Rukara. It's far away from Nyakagezi, where the main activities are. Then on the way back to the university, I found a pregnant woman that was about to give birth on the way to the hospital. So we helped, but it was not good support. Then we started asking what the problem is. We found out that there is a long distance from the health center and the village. We contacted the WHO, that's the World Health Organization in Rwanda, to find out if we need another health center or how we can solve the problem. So they came in 2006 to visit our activities. Then we talked to the authorities with another health center from Sovu. Then the decision was that there was a need to start a health center to solve the problem of access to health care in that community. So we worked with the authority, the government, we worked with the Sovu Health Center, and we worked with our international participants to get the initial equipments, and we turned the IP's house, that is International Participants House, that was located in Lukira, into the health center. So now it is being used for the health center. And all the equipment that were inside the house, we gave them to the health center as a starter. The future plan for the Huye Health Center capacity building is to give it more capacity so that it can provide quality health care to the people from that community, and also to train the nurses so that they can be able to handle some illnesses. We plan to train the nurses on integrated management of childhood illnesses. We plan to learn there a project on safe motherhood. We plan also to give the health center more equipment, medical equipment. And in the future, we are planning an outreach program where students from the National University can go to the health center and stay there maybe the weekends and do the visitings with the residents or someone from the National University, the medical faculty. In the future also, we are planning a partnership with other health centers so that can provide quality health care, but also try to link with other social problems of the people. Because sometimes we are providing medical care, and when they are coming for the hospitalization, they cannot get food. So in the future, we think it's better also to see how we can solve that problem together as multi-sectorial approach.